Hello, my name is Christina Smith, and I'm a public health nurse with Ottawa Public Health. I work with the mental health team. Today, I would like to talk with you about mental health supports for parents. The COVID-19 pandemic has been a challenging time for many of us. There have been troubling images on the media, changes to our routine, not being able to connect with our loved ones the way that we used to. This has all been challenging, and especially right now as we've been in this pandemic for over a year. As a parent, you're not only trying to look out for your own mental health, but you're also there to support your children. In this short video, I'd like to share some tips with you about how to be more resilient. I'll also share community resources should you feel you need that additional support. Before we begin, I would like to start by honoring the people of the Algonquin Anishinaabe Nation who have lived on this territory for millennia. Their culture and presence have nurtured and continues to nurture this land. I would like to honor the people and land of the Algonquin Anishinaabe Nation, as well as all First Nations, Inuit and Métis, their elders and their ancestors, and their valuable past and present contributions to this land. Now let's begin. First, think of strategies that have helped you cope with stress in the past. Which of these strategies worked well for you? Are there things that you've tried in the past that you can do right now to help you cope? We can't change the fact that highly stressful events happen, but we can change how we respond to these events. Dr. Tim Lau, psychiatrist and president of the medical staff at the Royal, said, "We have an opportunity on a scale never seen, together with the rest of humanity, to foster kindness and bravery that will transform this tragic but temporary situation into something much more meaningful. Hope and the choice to adapt and improve can be just as contagious, but more constructive and powerful. And it is something we will all need to work on in these uncertain times. If we do, we will all be stronger afterwards." Stay connected. Pay attention to your own needs and feelings and stay connected with people you trust. We know that having connections with people in our lives has a huge impact on our positive well-being. We can't get together with our loved ones the way that we used to, but there are still ways to stay safe while staying social. Take a few minutes in your day and do something you enjoy. The stress we're experiencing right now can be overwhelming. Trying to work while helping children with virtual learning can be challenging. When times are tough, it's especially important to take some time out of your day to unwind and decompress, even if it's just for 5 to 10 minutes. This can make a big difference for your mental health. Go for a quick walk to clear your head, read a book, or play with your children. Anything you enjoy that makes you feel more relaxed. Some people also find deep breathing or exercises or meditation to be beneficial. Keep your routines as much as possible. Though it can be challenging with changes in work environments, kids home from school, stay-at-home orders, try and maintain some sort of a routine. For example, try to go to bed and wake up at the same time every day, or add some daily exercises into your routine. You could try to make a schedule or a timetable if you find that helpful. Practice positive self-talk and think of yourself in a positive way. The way we think about things affects our feelings and our actions. Thinking positively can help you overcome a challenge. And finally, seek support when you need it. Asking for help is a sign of strength. Reach out to someone you trust and feel comfortable talking to. It's important to acknowledge the feelings that we're having right now and pay attention to signs that we might be having difficulty coping. Some signs include difficulty sleeping, changes in your mood or increased stress, or increased use of alcohol or other substances as coping mechanisms. There are mental health resources available in our community, which I'll go into in the next few slides. We're very fortunate to live in a community that has free mental health resources available. A few important examples include the Mental Health Crisis Line, which can be contacted 24/7 and is available in both English and French. You can call their local number at 613-722-6914. A brand new resource that has been launched is called Access MHA, and you can learn more at accessmha.ca. This portal provides a single point of entry to Eastern Ontario's system of care for mental health and addictions. Anyone looking to access mental health and/or substance use support or services can complete a form online, and they'll be paired with a trained mental health and addiction professional who will then connect them to the services that they need from a network of partner organizations. We also have short-term counseling services that are available to us. One example is Counseling Connect, and you can reach them at counselingconnect.org to book a free counseling session by phone or video. They offer services for all age groups, and they have specific counseling services for people in the African Caribbean Black community, the LGBTQ2S community, as well as people in the Indigenous community. There's also the walk-in counseling clinic that is partnered with Counseling Connect, but they will provide in-person counseling services when public health measures allow for it. And they provide services in multiple languages, including English, French, Somali, Cantonese, Mandarin, Arabic, and Spanish. You can learn more and contact them online at walkincounseling.com or by phone at 613-755-2277. I'd also like to highlight Parents Lifeline of Eastern Ontario. They're a peer support group for parents that have children experiencing mental health challenges. They provide family peer support through integrated services specifically designed to support parents when, where, and how they need it. And they work together so that parents can move seamlessly between them. For more information on these resources and to learn about many more resources available in Ottawa, visit ottawapublichealth.ca/COVID mental health and go to the Mental Health and Substance Use Services and Resources page. Thank you, merci, and Meg Witch.